My life used to be all about fast cars, parties, and chasing girls. Now it's all about this little girl. She's gotten me to make changes even my wife couldn't. I figure if I live forever, she'll never be able to start dating. It's because of her I stopped smoking. I also cut way back on the fried stuff. Hey, I even brush my teeth every night. My dentist told me how important it is to take care of my mouth. He said problems with my teeth and gums could lead to other health problems.
The relationship between oral infection and systemic illnesses has been around for almost 4,000 years. It was originally described by the Egyptians, and then through the centuries we have had continual reports of this sort of association. Particularly there's been interest dealing with cardiac disease, pulmonary infections, as well as diabetes mellitus. Anything that's going on chronically in your body, you would prefer not to have happen. So being able to intervene is very important for the dentist to be able to do. Reduction of inflammation in the oral cavity is extremely important because, as we all know, the two major diseases that we treat, caries and periodontal disease, are due to bacterial infections, which cause an inflammatory response. If we reduce the inflammatory component, we reduce the chance of any sort of deleterious effect happening in the oral cavity.
Triclosan is a very versatile molecule. It not only is an antibacterial, but more recently we've learned that it's an anti-inflammatory agent. How it works is to be absorbed in the soft tissue in the oral cavity, where it is retained for a long period of time, 12 hours in fact. This has been looked at in plaque and gingivitis studies, where we have seen that the effects on gingival inflammation exceed the effects on plaque. So we have not only shown that there is 12-hour protection against plaque, but we've also shown that there is 12-hour protection against gingivitis, halitosis, and calculus formation.
Numerous studies have shown that triclosan is an antibacterial agent as well as an anti-inflammatory agent, and is a good method for reducing oral bacteria as well as reducing oral inflammation.
Colgate Total is indeed the #1 recommended product here in the United States, recommended by dental professions.
As a periodontist, I recommend Colgate Total for all my patients because of its anti-inflammatory as well as antibacterial effects in the oral cavity.
Colgate Total has proven in 52 clinical studies that it is substantially different from all these other clinically tested products too. It is clearly the product of choice for anyone who wants to maintain their teeth and gums for a lifetime.
Oh. So now Maria and I brush our teeth together every morning and every night. Turns out that's the best nightlife for both of us.
A heart attack changes everything. You learn not to take anything for granted, especially the things that matter the most. My cardiologist talks about eating healthier, exercising more, reducing stress, the usual stuff. But what surprised me was when he asked if I'd had gum disease. It turns out there's growing evidence possibly linking oral inflammation to heart disease. I've become something of a fanatic about my oral care ever since. My husband says I could win the brushing Olympics.
And the question is, if you now intervene, if you treat these people, if you reduce the level of periodontal infection or inflammation in the mouth, is the likelihood greater that they will not have a second heart attack? What we currently think is that the ability of the bacteria within a periodontal pocket to enter the bloodstream, the ability of inflammatory mediators to enter the bloodstream from the mouth can easily reach the entire body, distant sites and distant organs, and that bacteria may in fact injure the endothelium of distant vessels and can have an effect on atheroma formation and contribute to atherosclerosis. Since we believe that poor oral health is a risk or a contributor to cardiovascular disease, we certainly then believe that good oral health may decrease the risk.
Triclosan is a compound that has a broad spectrum antibacterial as well as anti-inflammatory effects. From the antibacterial side, triclosan has been shown to be very effective at preventing the buildup of bacteria that cause dental plaque. The anti-plaque activities were measured to be up to 98%.
I have been recommending Colgate Total since it was introduced into the market a number of years ago in the U.S.
After surviving a heart attack, you definitely feel more vulnerable. So if keeping my mouth in good shape is part of staying healthy, I'm going to do it.
And that's what some of us think Chaucer was talking about. That'll be all for today. Teaching English to college students is my full-time job and my full-time love. Chaucer, Shakespeare, Toni Morrison, we cover it all. So if I miss one day of class, my students miss 100 years of literature. So I can't let my diabetes make me late for class. See you Thursday. Even my dentist helps keep me on the job. The last time I went in, he reminded me I need to take extra care with brushing and flossing. Hey, if I can make Hamlet interesting to freshmen, making sure my mouth stays healthy is no problem.
It was recognized some time ago that diabetic patients who are not well controlled or who are poorly controlled are at greater risk for developing gum disease or periodontal disease. The studies now actually are looking at how periodontitis makes it more difficult to control diabetes, and how in patients who have periodontitis who are diabetic, they may be put at greater risk for developing some of those other long-term complications. We recognize that in patients who have chronic inflammation, particularly in diabetic patients, when they have elevated levels of the factors involved in inflammation, such as cytokines and prostanoids, and other factors that are known to be involved intimately with inflammation, that this causes insulin resistance in diabetics. So it's our job in dentistry to address both the infection in our patients with periodontitis who are diabetic and to decrease the inflammation so that the physician can gain better control of their patient.
There's only one toothpaste in the United States that provides both antibacterial and anti-inflammatory activity. That toothpaste is Colgate Total. The toothpaste works because it contains a unique antibacterial ingredient, triclosan, which Colgate has formulated with a copolymer, and together the two attach to your teeth and provide up to 12 hours of protection for your oral soft tissues. Over the years, we've conducted many clinical studies with Colgate Total. In these numerous clinical studies, repeatedly the product has proved effective against many parameters which your patients need to maintain their oral health.
To brush or not to brush? Was there ever a question?